Hello, it's Bruce Williams again, and today I want to give you a short lecture on the selected gross pathology of the hamster. As I do at the beginning of all of my lectures, I want to thank my colleagues and friends who provided me images over the years, which allow me to put these lectures together. Okay, this is what is known as the Syrian or golden hamster. Most golden hamsters today originated from the same litter which was captured in Syria in 1930, which has resulted in a low number of major histocompatibility genes in this species due to extensive inbreeding. They're so similar genetically that you can take tissue from transplants from any two hamsters and transplant them into each other, and they'll grow just fine. But unfortunately, when you have this level of inbreeding, it makes this particular species, or any species like it, markedly susceptible to viral infections. Here is another species of hamster that is occasionally used for specific reasons in the laboratory, and you'll see them on the internet as hamster pets. And this is known as the Chinese hamsters. It's smaller, it's sort of a mousy brown, a gooey color, and it has a black racing stripe down its body. And aside from one particular disease in Chinese hamsters, I don't know very much about them at all. It is interesting that the Syrian hamster has 22 chromosomes, and the little Chinese hamster only has 11 chromosomes. So I guess the bigger you are as an animal, the more chromosomes you get, or something like that. There's some interesting adaptations of the Syrian hamster, primarily for desert living. And one of the more interesting ones is the very large cheek pouches. We see these in other rodents as well, but cheek pouches in the hamster are highly distensible. And more importantly, they're an anatomically privileged site. And this was very important in the days before athymic nude mice developed, because you were able to transplant tumor cells into this sort of immunologically isolated site, and they would grow there. And it wasn't a whole lot of fun to do this with hamsters, because you'd have to anesthetize them, then you'd have to go in and you'd have to avert the cheek pouches and get all the food out. And this can also be a problem before any type of surgical procedure, because the investigator would ask for you to fast these hamsters for 4 hours. Then you'd have to knock them out. You'd have to take out these cheek pouches and pull all the food out. Then you'd have to go through their cages because they'd have food stored away in them. And it was just a real problem. Thank goodness for nude mice now, which has made life a lot easier for people working in rodents. Male hamsters also have dorsal marking glands. These are paired glands which are used for scent marking. They consist of a combination of sebaceous glands and pigment cells and some terminal hairs. And they also, besides their use in marking territory, appear to have a secondary role in hamsters, especially male hamsters, in the conversion of testosterone to dihydrotestosterone. Okay, let's take a look at some of the diseases of this species. Back in the days when I was in practice, whenever you saw a hamster, you knew it would come in with something that everyone called wet tail. And wet tail is a pretty abused term for a variety of bacterial causes of enteritis in this species. As in many of the rodent species that are used in the laboratory, bacterial enteritis tends to hit the young animals predominantly, especially the weanlings. Usually after they get into adulthood, they're pretty hardy. And hamsters are very important in the history of the diagnosis of a bacterial condition which is caused by Lawsonia intracellulare. And we've talked about Lawsonia in a wide range of species, including the lectures on swine, lectures on rabbits. We've talked about it with ferrets, but hamsters were the first species in which it was identified as a pathogen and a classic cause of wet tail in hamsters. In the hamster, it's very similar to what we see in swine. It results in epizootics in younger animals, primarily weanings, with immune resistance developing at about 10 to 12 weeks. You get a marked enlargement and swelling of the ileum, so it's a primary ileitis. You get a glandular proliferation of cells which are infected by the bacterium, releases them from the inhibitory factors secreted by surrounding cells, and you get a tremendous proliferation in focal areas of immature enterocytes, often associated with inflammation and bleeding. And it resembles ileitis in pigs very closely in that fashion. This animal also has a very large cecum. They are hindgut fermenters, but you will get inflammation in the cecum and rarely in the colon in this disease as well. Environmental changes can result in outbreaks and even disease in older animals. And when you have an outbreak in a hamster colony, usually you expect a morbidity of about 50 to 60% of the animals and a mortality of about 90%. And when you look at sections of the gut, you'll see these tremendous proliferations of immature enterocytes, which don't look a lot like the surrounding enterocytes lining the gut. You see a lot of nuclear crowding. The cells are large. They have basophilic nuclei, and there are large numbers of mitotic figures. Any good silver stain that is put on these areas will demonstrate the presence of large numbers of rod-shaped bacilli within the apical cytoplasm of the immature proliferating cells. So this is Lawsonia intracellulare, classic cause of white tail in hamsters. They do get a number of other agents which will cause enteritis. A wide range of Helicobacter species have been identified in hamsters, and hamsters can also be infected with Helicobacter pylori. This is a colitis in hamsters. They will also get gastritis. They will get intestinal metaplasia, which is a metaplastic change of the stomach lining to something that more resembles that which we see in the intestine, with their most commonly found Helicobacter species, Helicobacter aurati. You'll hear the term aurati, A-U-R-A-T-I, for a number of agents in this particular lecture, and that actually means hamster. There's also a version of Helicobacter in hamsters, which causes changes in the liver, especially around the bile ducts, fibrosis, and that's caused by an agent known as Helicobacter cholecystis. Here is one of those areas of proliferative gastritis. It doesn't look much at all like the normal stomach. Look at these immature, somewhat enterocyte-looking cells, and tremendous proliferation. Some necrosis at the top. This is Helicobacter aurati and the change that it makes in the stomach. You can see a tremendous number of spiral bacteria in the normal stomach of hamsters. It's probably a lot of these Helicobacter species. They're long, they're very lush, and unlike Lawsonia, they live within the extracellular space, deep in the gastric glands. This was taken from that picture that I just showed you of the proliferative gastritis. You can see a couple of them here. So they're long, they're spiral shaped, which is often obscured by the silver that's deposited on them. So when you look for spiral bacteria, you might just see some long bacteria, and that's probably going to be because silver is sort of a dirty stain, and it might obscure some of the fine histologic features. Here is some of the cholangiofibrosis from an article in the Journal of Clinical Microbiology from about a decade ago, showing the cholangiofibrosis and the fibrosis in the liver in animals affected with Helicobacter cholecystis, which is classified in the cluster that includes Helicobacter bilis, which is commonly seen in mice. Hamsters are a very common laboratory species whose intestine contains a number of commensal diplomonads, a family which includes Giardia, Spironucleus, and Hexamina. And the classification has changed over the years from Hexamina to Spironucleus to Hexamina to back to Spironucleus, and most of them now are considered Spironucleus. But if you hear the name Hexamina, these are all flagellates, protozoas that live within the intestinal crypts, commensals, and usually cause absolutely no problems. And you'll see them in large numbers. In severely stressed animals or immunosuppressed animals, they may go systemic and cause systemic infections. That's obviously going to be a problem. So systemic spironucleosis has been identified in some laboratory rodents. It's also been seen in irradiated rhesus macaques, one of the only other mammalian species in which spironucleus has been identified. Giardia is a flagellate that I think gets a really bad rap, but probably not in hamsters, where it can actually cause disease. All hamsters have Giardia, and it's usually asymptomatic, but some animals will develop marked gaseous distension and thickening of the colon wall. And this is a very thickened colon wall here. Infections or abnormal infections with Giardia may result in wasting in hamsters and concomitant hepatic amyloidosis. Probably Giardia murus, the same agent that is commonly seen in mice and rats. Remember, humans get a different species, Giardia lamblia, which you can also see in non-human primates. You'll see Giardia murus in mice and rats and hamsters and gerbils and all that. And we see with a number of the ecto and endoparasites, especially in like pet store settings or something like that, they tend to jump pretty readily between mice and rats and the other rodent species. Here's a very nice picture of a spironucleus within the intestinal crypts of a hamster, and this hamster is perfectly normal, and you'll see these all the time. There may be some Giardia hiding in there as well, and usually causes absolutely no problem. Now, an agent that does live in the intestine and colon, which will cause a tremendous problems, especially if you decide to treat any of these bacterial diseases with just a little touch of penicillin or any of the mycins like lincomycin or erythromycin, is Clostridium. Remember, as we get farther away from humans and non-human primates and through our traditional species down into the rodents, the birds, and the reptiles, we tend to have a much more prevalent gram-positive flora within the enteron. And the most common bacteria in the hamster gut is Lactobacillus and Bacteroides. And even a single dose of penicillin or the mycins will precipitate the overgrowth of Clostridium, especially Clostridium difficile, toxin production, and death resulting from the necrohemorrhagic enterocolitis that is caused by this particular agent. Even non-treated animals in the same room may get a fatal typhlocholitis. This has also been reported on animals and on an atherogenic diet. The toxin was not isolated in the diet, nor was the agent, and no antibodies were administered. So that one probably never quite got figured out. But be very careful and realize that the rodent gut is very different than our domestic animal species in terms of its population and its response to antibiotics. The histologic lesion that we see in clostridiosis in hamsters and guinea pigs and rabbits that are given these sort of broad spectrum antibiotics is very, very similar to what we see in any species with clostridial toxicity, including a sort of wave-like area of hemorrhage and necrosis, which corresponds to the toxin diffusing into the mucosa. You will see, if you look closely, the adherence of the large, robust Clostridia to the mucosal epithelium, but the necrosis goes way deeper and eventually will become transmural in these animals. Here's a agent from the colon that we have talked about in all of the rodent species, and we're going to talk about it in hamsters, and we're finally going to end up talking about it in gerbils as well. And you're going to see the same slide, unfortunately, for hamsters and gerbils, but it's a great slide. It illustrates the multifocal area of necrosis that is so characteristic of Tissers disease or Clostridium piliforme infection in rodent species. Clostridium piliforme is a normal inhabitant of the rodent gut in very small numbers, and when there is any form of dysbiosis, whether it's antibiotic associated, maybe it is due to a change in the animal's diet, a lack of fiber in some of the hindgut fermenters, you may have an overgrowth of Clostridium piliforme, which will cause necrosis in the wall of the colon or the cecum. And at that point, it will enter the portal circulation, and in addition to the necrosis in the gut, you will get these bacteria which take up residence in the liver, and they will do the exact same thing by secreting cytolytic exotoxins. They act as perforants, and they very non-specifically will punch holes in whatever cell is normal. They very characteristically will invade hepatocytes, and you will see these large areas of necrosis. Centrally, there will be nothing but devastation and necrosis. That's the oldest area. And then the hepatocytes around them, you will be able to see them within the cytoplasm as long, robust, thin bacilli. People call them haystack formations or pickup sticks if you played pickup sticks when you were a small child. They look very much like that. Not difficult to see on H&E, and a silver stain is going to demonstrate them very nicely. We're running out of gut diseases in a hamster, and they don't have much else to talk about. So one of the things that you will see in hamsters, and you'll also see this in mice and rats, are intestinal parasites. Okay, this is a tapeworm that we see in laboratory rodents, which used to be called Hymenolopus nana, but has been changed for reasons unknown to me to Rodentolopus nana. And in most rodent species, infections are, especially if you get them from the pet store, the infections are common, but they're asymptomatic. The life cycle is a direct one. They usually don't cause much of a problem. You'll see the immature larva within enterocytes. In man, there is a related tapeworm, Hymenolopus diminuta, which does have zoonotic potential. But I guess nobody's going to rename the one in man to Rodentolopus nana. So we have that much going for us. And these are the eggs that you can see, and they do have a shell. And this is a fecal flotation, and they characteristically have this sort of hooked larva. And you can see this also when you examine the tissues histologically. It's refractile and very characteristic of this particular species. Colonic intussusception with rectal prolapse, not uncommon in a variety of these bacterial enteritis, especially Lawsonia in the hamster. Here's a little histologic thing. I know it's a gross lesion, but I don't have enough on hamsters to make for a very interesting gross lecture. So I threw in a couple of histos, and you will see when you look at hamster tissues, you will see a lot of intranuclear and these sort of patchy intracytoplasmic inclusions in hamster tissue. This has been written up a number of times. Nobody really knows exactly what they are. The intranuclear inclusions generally represent nuclear membrane invaginations or an increase in the amount of cytoplasm, and this will push into the nucleus, sort of like when you have a poorly inflated water balloon and you push your finger or your fist into the side. That's sort of what these are. And it represents sort of cytoplasmic swelling, and these patchy areas have been interpreted as lysosomes in the past, so you might see these changes in tissues if you ever get a chance to look at a hamster study which have undergone sort of a chronic injury. Okay, a disease which is well known in hamsters is polycystic disease, which affects a number of organs. This is considered to be a congenital problem, although no one's really worked it up. And you will see cysts in the liver, which are thought to be sort of a failure of the intralobular and interlobular ducts to either join during development, or maybe some superfluous bile ducts to disappear. Some people may call these von Meyenberg complexes as well, but they're generally ductal plate malformations of some type. And you may see these in association with renal cysts in other species, but in hamsters, it's a different range of organs. Usually they're seen along the accessory sex glands, as we see here. You can see them in the testes, especially along the epididymis, and you can also see them in the pancreas. They're all considered incidental findings at necropsy. Just realize that cysts on various organs are very common in hamsters. A disease which old hamsters are very prone to get, as are certain strains of old mice, is amyloidosis. And I think that the pattern of amyloid that you see in the hamster is somewhat unique. It is beautiful. Almost looks like something you'd want to make into your wallpaper, maybe a nice looking purse, but it has this sort of reticulated appearance. It's very characteristic in gross appearance of amyloid in hamsters. Amyloidosis in hamsters may be seen as early as 5 months and often is the result of renal insufficiency and loss of anticoagulants and sort of disarray of the immune structure or the immune system of hamsters. They will throw amyloid at the very least amount of inflammation, and you will also at the same time start to see amyloid being put down in the kidney as well. It's a common cause of mortality in old hamsters, this systemic amyloidosis. And if you look at this liver, look at the amount of amyloid, okay, here, and the atrophy of the hepatocytes. It's absolutely remarkable how much amyloid they can get into their liver, and how long they can last as they compress and compress before they develop, either renal or liver failure. I think the only two other species that can do it to this extent are horses. Some of these old horses that are used to make antitoxins and antivenins. It's just amazing how much amyloid you'll see. And non-human primates, they can get their hepatocytes down to almost little slivers before they succumb to that or another disease. In the kidneys, it's going to cause a very pale, enlarged kidneys, as you would expect in amyloid in most species, but this is a very golden and white. The normal kidneys of the hamster are what I consider normal kidney color. It's a healthy brick red. And, you can tell that this picture from Dean Percy, this animal, had tremendous amounts of amyloid within the kidney. It's generally glomerular, but you can see some in the interstitium and the medulla as well. One of the consequences of both renal insufficiency due to chronic bad kidneys, which all old rodents get to some extent, and the amyloid, which causes tremendous loss of coagulation factors, is atrial thrombosis, especially in the left atrium. Okay, when you see that, the next thing you want to look at is those kidneys and take a look at it. Sometimes you can see cardiac insufficiency play a role in these old hamsters, but I'm looking at the kidneys first and foremost. If you do monitor these animals with ClinPath data, you're going to see changes in the coagulation parameters as well as the FDPs and other markers of fibrinolysis in these affected animals. And this systemic amyloidosis, especially if the animals are kept on long-term studies, you'll see it in 33% or more of the animals in the colony. So it's not an uncommon finding. Here's just another older picture from the AFIP showing one of these large atrial thrombi. One of the other things that you'll see in animals with amyloidosis or other forms of renal insufficiency is loss of plasma proteins resulting in this tremendous edema or anasarca throughout the animals. I told you I'd talk a little bit about the Chinese hamster, and I certainly don't know much about Chinese hamsters, but they do develop a form of type 1 diabetes in which the islets are attacked by the immune system, and that's why they are used in diabetic research. Unlike traditional diabetes, in more the type 2 diabetes in which the islet cells accumulate glycogen and they swell, these islets will involute as a result of the immune response, and they will become necrotic rather than large and prominent and easily stained with PAS like traditional diabetes in most animal species. Well, here are some lumpy, bumpy old kidneys. Not a great picture of what you see in hamsters, but you can see an irregular pattern. And this, as we said before, all laboratory rodents get their own specific breed of progressive nephropathy, which often claims them at the end of life. And if you want to keep track of that, the disease in hamsters is known as arteriolar nephrosclerosis. It is very similar to what we see in chronic progressive nephropathy in the rat, except in the hamster, it is more prevalent in females than males. There are distinct glomerular changes, but it's not immunoglobulin, and you can often see amyloid in these old kidneys as well. You may see a fibrinoid change in some of the large vessels, which gave rise to the name arteriolar nephrosclerosis, but it's really more of a necrotizing change than a sclerotic change. Just realize that all old laboratory rodents are going to have bad-looking kidneys if you get them to a late stage in life. Another thing that you'll see are para-ovarian cysts. We talk about true ovarian cysts in guinea pigs. Most of your other rodent species have para-ovarian cysts. It is an accumulation of fluid within remnants of various, the epithelialtropic and mesonephric tubules and something like that, but it's not within the ovary as well. There are no gross lesions associated with a disease of hamsters that has a number of concerns for non-human primates. And that is a disease which is known as lymphocytic correo meningitis. It is caused by arenavirus. And arenavirus is generally an asymptomatic infection in hamsters and other rodents. Mice and rats will carry it, and they can transmit it to non-human primates. In New World monkeys, it causes a disease known as clostridium hepatitis. In humans, it causes lymphocytic correo meningitis and is a real concern in people who are immunosuppressed, who are around hamsters or rodents, which makes them a very poor choice of pet for anyone who has had a recent organ transplant. In the hamster, it's generally asymptomatic and is transmitted from hamster to hamster through the saliva or the urine. All infected hamsters will shed lots of virus in the urine, and it's readily transmitted in between. It can also be transmitted transplacentally in rodents. In experimental infections, most of the neonates and about half the young adults develop persistent viremia. So this can be a real problem. And the virus itself doesn't cause any particular disease, but the presence of virus, like we see in other species, maybe with some innocuous parvovirus like Aleutian disease, the presence of the virus causes a tremendous production of antibodies against it. And eventually, over time, you will see tremendous numbers of plasma cells within a number of places, including the meninges, from which you get this name, lymphocytic correo meningitis. You also will develop glomerulonephritis at the point where there are so many antigen-antibody complexes in the blood that they just eventually start to precipitate out into the walls of blood vessels. And of course, they'll do this in the blood vessels throughout the body, but the biggest concentration of blood vessels in your body is the capillary bed of the glomerulus. And so these innocuous viruses, like the Syrian virus, may be a cause in certain species of immune-mediated glomerulonephritis. Okay, so about half of these animals are going to develop chronic disease. The other half are going to eventually clear the infection. It's also been shown that immunosuppressing infected animals will decrease the severity of this lesion. And the lesion is very similar in the brain to what we see in infected humans. So lymphocytic choriomeningitis caused by an arenavirus. Arena means sand. It translates into sand because that's what the first people that visualized these viral particles thought they looked like. On EM, looked like sand. So lymphocytic choriomeningitis, a significant concern in immunosuppressed patients who have rodents or exposed to rodents during the course of immunosuppression. Oh, here's a nice little article from John Edwards a number of years ago in VetPath. And this was the result of a couple of kits of laboratory hamsters who had a congenital hydrocephalus. And we see this also in C57 black mouse who have a congenital form of hydrocephalus, and the lesion is very much similar. And these animals do very well through the period of weaning. They have sort of a dome-shaped head, and they have these large ventricles. And after weaning, when they have to go into the working world as adults and vote and drive cars and things like that, they don't do very well. So they're good up until they mature, and then they just don't do very well. Same thing is seen in mice with a similar disorder. It's a congenital issue, and usually the best way to take care of it is just cut out that particular line of the mice. Hamsters are a classic model of degeneration of the cerebral white matter as a result of being fed, or the dams being fed, a vitamin E deficient diet. Usually there is a subependymal vascular degeneration, and this is what it looks like. That's pretty devastating, I think, in the developing hamster pup. And usually these pups are eaten by the mother. They're cannibalized. She knows that, when they're born, they don't move, something wrong with them, so they will go ahead and take care of them themselves. Well, there still are a couple of classic diseases of hamsters out there, and we still see them. And this is a great disease of hamsters, which is caused by a polyomavirus. It used to be a papovavirus, but then they split papova into papilloma, polyoma, and vaculating viruses. And I don't have anything to say about vaculating viruses. But when we talk about polyomaviruses, there was a classic disease which was first identified in a facility run by a fellow named Coggins, who raised lots and lots of hamsters. And he had this polyoma virus within his facility. And he got two specific diseases. Okay, in the young animals, because all the hamsters were exposed between, somewhere between the age of 1 to 21. They're all exposed to the disease, and more than half of the young hamsters developed lymphoma, primarily within the mesenteric lymph nodes and the intestine. Here's one that also has lymphoma in the liver. Gives us sort of that nice pattern of amyloid, but this is a very young hamster. It's a weanling hamster, so you wouldn't expect amyloid at that point. But you can see this enlarged mesenteric lymph node. And between the years 1975 and 1979, there were almost 4,000 cases of this. So someone was going in there and doing necropsies and tracking this. But the interesting thing was, although they knew that they had the virus in the colony, they could never identify the virus from the tumors. Now, this will go into a naive colony and cause an epizootic. And generally, most people, if they have it in their colony, if they're producing hamsters, they just slaughter all the animals, start over again to rid the colony of the virus. The transmission of this virus is generally either through dried cage litter containing urine and feces of the affected animals, or they could transmit it through aerosol or direct animal contact. So everybody's going to become infected with it. It was common in that particular facility, for more than 25% of newly introduced hamsters to die of diarrheal disease within 5 weeks of exposure to hamsters carrying this lymphoma agent. In affected animals, most lymphomas arise in the large and small intestine and the mesenteric nodes, but you could also see it in the liver, the kidney, the thymus, various lymph nodes, the stomach, and even the eye. I would say probably we get 1 or 2 cases of this a year. We don't do a lot of hamsters here at the JPC. And then every couple of years, someone will submit it for the Wednesday slide conference. So this particular virus is still out there, and you can still see the disease. And this is what you see in that liver with the beautiful pattern. You just see tremendous numbers, sometimes up over 300,000 of these immature neoplastic lymphocytes. So this is what was seen in the young animals. Now, the disease caused by the same virus in older animals is very different. This form is usually seen in the infected adult animals, not the young animals, and these tumors do contain infectious polyomavirus, although it's not always necessary for transmission. So, and the lesions are a variety of benign follicular tumors, usually trichofolliculomas, tumors that represent every part of the hair follicle and often surrounded around a duct. Some people call these trichoepitheliomas, and that's fine too. But when you see this in hamsters, you want to think about the possibility of this transmissible papillomavirus, which causes this really odd disease, lymphoma in young animals, and these skin tumors in the older animals. Speaking of older animals, hair loss. Decrepit old hamsters have a variety of diseases that you'll see on a regular basis. We've talked about amyloid. Old kidneys are often immune suppressed as well, and because of that, normal demodex, which is part of their normal skin flora for their entire life, will start to take over and will reproduce in very large numbers. You'll see 2 primary forms, demodex auratus and demodex crescenti, and you rarely see lesions in young animals, but they all have them. And you'll also see these 2 agents sometimes in mice and rats from pet stores, and they do tend to jump between species. This was demodex aurati. This is a long, parasite which lives in hair follicles. The form demodex crescenti, more traditional, what we think about demodex, will live in pits within the sebaceous glands or the ostia of hair follicles. They will also live in sort of shallow pits in the epidermis as well. And here are some of those demodex living down in the ducts of the sebaceous glands. Well, getting close to the end, a couple of also-rans. This is a case of botryoomycosis in a hamster. in the foot of a hamster. Remember, the botryomycosis is something that we most usually associate with mice, but you can see it in any animal species. Rodents will get it. It is a chronic infection with staphylococcus. There are a couple of other agents that will do this as well. Staph aureus, staphylococcus are ones that you want to think about. Pseudomonas can also do this. And when the body, these are generally low pathogenic organisms, but for some reason, some of the rodents cannot get rid of the infection. And so they tend to wall it off with a thick layer of what's known as splendorohoplite material, but this is sort of an eosinophilic aggregate of accumulated antigen-antibody complexes. And if you put a gram stain on it, you'll light them up very nicely within, and it's generally surrounded by a lot of neutrophils and then walled off by fibrous connective tissue. Usually think about Botrytis in mice, but you can see it in a wide range of species. It's been documented in the lungs of cattle, and in people the term is used. So when you think botryomycosis, don't just think mice. And then finally, one of the skin tumors that you'll rarely see in hamsters is Tcell epithelialtropic lymphoma, also known as mycosis fungoides. This is not virally induced. It is a spontaneous lesion that is seen in older hamsters. Okay, well, that brings us to the end of this lecture on the pathology of hamsters. I hope that you have enjoyed it. It's brought a couple of diseases to mind. There are some important diseases in here. So that's it. I got one more laboratory rodent species to do. That's going to be gerbils. That'll be our next lecture. Hope you come back for that. I hope you come back to the Foundation's Facebook page and YouTube channel on a regular basis, as we will continue to put up lectures focusing on the gross pathology of a variety of domestic laboratory, and eventually I'll get to some of the exotic species. Hey, I hope you have a great day.